When you're depressed or anxious, you might think the first thing to try is therapy. And that makes sense, right? Well, maybe that shouldn't be the first place you start. Let me tell you a couple of quick stories. A woman in Australia developed depression out of the blue. There were no big changes in her life, but then she started having stomach pain, a cough, and night sweats. Depression and memory problems followed. So luckily, doctors did an MRI scan and found that there was a lesion on her brain. When they did exploratory surgery, the surgeon was completely shocked to find a live 3-inch parasite in her brain. This is super rare, and it's an extreme example. I'm not saying that any of you have this. What I am saying is that no amount of therapy would have solved this depression for her. Medical conditions frequently contribute to mental health conditions like depression, and we should just get checked for them early in the treatment plan. Let me give you a couple more examples. Selena Gomez has publicly shared her struggle with anxiety and panic attacks and depression, which she attributes a lot to unmanaged lupus, an autoimmune condition. And you may have heard Lisa Healy's story in the news. She was treated for depression and chronic fatigue for 22 years before she was diagnosed with latent anemia. Once her iron levels were fixed, her depression and chronic fatigue went away. I personally had super high anxiety when I was pregnant, but when I talked with my doctor about muscle cramps and started taking magnesium supplements, my anxiety decreased by like 50%. And I personally believe that that low magnesium was most likely contributing to my anxiety. We just can't ignore the massive impact our physical health has on our mental health, and vice versa. But today we're talking about the physical health part. So let's talk about 6 common medical conditions that can fuel depression or anxiety so that you can rule them out before paying for years of therapy. There are quite a few physical medical conditions that can look like or contribute to mood disorders like depression and anxiety, and people often go years without realizing there's an underlying biological cause. And this is the biopsychosocial model of mental health. When our physical health is poor, it affects our mood. When our mental health is poor, it affects us physically. And when our environment and relationships are stressful or dangerous, that affects our mental health as well. So here's 6 areas to screen for. First one, hormone and endocrine issues. Thyroid disorders. An underactive thyroid can mimic depression with symptoms like fatigue, low motivation, and sadness. When my dad got treated for low thyroid, his depression symptoms were like greatly improved. And hyperthyroidism, which is an overactive thyroid, can cause anxiety, restlessness, and panic symptoms. Adrenal dysfunction is much less common than thyroid issues, but Addison's disease or Cushing's syndrome can create severe mood and energy fluctuations. And diabetes or blood sugar dysregulation can trigger irritability, anxiety, or shakiness. High blood sugar can cause fatigue and brain fog. Another big one is perimenopause, menopause, PMS, PMDD. Yay, being a woman, it's the best. Hormone changes can significantly affect mood, sleep, and anxiety. Premenstrual dysphoric disorder can start in your early teens and make people feel horrible, suicidal, depressed, and anxious, panicky, terrible, right? And it's just not been treated enough. There are treatment options. Most people just don't know about them or talk about them with their doctors. And on that note, perimenopause can start in your early 30s. So, that is one of the biggest causes of kind of like a fresh resurgence in anxiety that we see for people in their late 30s, early 40s. So worth looking into. And lastly, low testosterone. Testosterone levels affect men and women, but when it's low, this can really impact mood, energy, and it can mimic depression. It's also easy to test for and easy to treat. So you can talk with your doctor about ruling out hormone issues through blood tests. There really are some good medical treatment for these, from medication to hormone therapy to behavior changes. Okay, number 2, nutrient deficiencies and metabolic factors. One of the most common is a vitamin B12 deficiency. This can cause fatigue, memory problems, low mood, and even psychosis if severe. Low vitamin D is linked to low mood, seasonal affective disorder, and fatigue. Low iron or anemia can cause fatigue, brain fog and mimic depression. You can ask your doctor to run blood tests to screen for nutrient deficiencies and other conditions. And then under the guidance of your doctor, you can consider supplementing. A few other supplements that have pretty consistent evidence behind them include magnesium, omega-3, curcumin, and coenzyme Q10. Okay, here's number 3, sleep issues. I saw one study that showed that people with depression and sleep disorders, when they resolved the sleep disorder, 87% of them saw their depression symptoms resolve, go away, when they solved the sleep disorder. So there is just a massive correlation between sleep and emotional regulation. And the biggest factor in this, I think, is simply just not prioritizing sleep. I think it's like the last thing people think of. So they often get super sleep deprived and they don't realize how much that's impacting their mood. In addition to that, you could check for sleep apnea, restless leg syndrome, insomnia, or other sleep disorders like parasomnias and sleepwalking. There are a lot of non-medicinal options to get better sleep. And this includes sleep hygiene, CBT for insomnia, and if those aren't working, you can get a sleep study or use sleep apnea devices like a CPAP. And if you've never worked on your sleep habits, you can check out my playlist on sleep. Okay, number 4. Most people don't know that there's a lot of medications that have side effects that impact mood. I'm just gonna list a few. Anxiety can be exacerbated by stimulants, including ADHD meds, thyroid medications, decongestants like Sudafed, asthma inhalers, including albuterol, steroids or corticosteroids such as prednisone or methylprednisolone. I don't know how to say that. My sister went on a steroid and couldn't sleep well for days, which made her super anxious. And certain antidepressants can make you anxious, depending on the type, especially in the early phase, like the first 1 to 3 weeks. And birth control or hormonal treatments can impact anxiety symptoms. Okay, and depression can be a side effect of beta blockers, hormone medications, Accutane for acne, corticosteroids, benzodiazepines like Xanax, blood pressure meds, opioids, statins. Now this is rare with statins. I've seen some studies showing that statins can help with depression. So the whole point of this, please don't just quit taking your meds. Mental health is complex and there's a lot of factors to consider. Not everyone experiences these side effects. Some people feel a lot better on medication, specifically these medications. But if someone's anxiety or depression started soon after starting or changing a medication, that's a clue worth discussing with your doctor. The whole point here is to look at your health holistically with your medical provider. I'm not trying to replace your doctor here. It's also worth noting that caffeine, alcohol, or drug use or withdrawal can fuel anxiety, depression, or sleep changes. Okay, number 5, chronic illnesses and systemic conditions can directly impact mental health. PTSD and other mental health conditions are really closely correlated with autoimmune conditions and other chronic illnesses. Trauma seems to fuel these autoimmune conditions, and autoimmune conditions can fuel mental health conditions. So this includes like lupus, Hashimoto's, multiple sclerosis. All of these can affect the brain and mood through inflammation. Also, chronic infections or chronic inflammation, including things like long COVID, Lyme disease, or Epstein-Barr virus, may trigger fatigue and depression. Chronic fatigue syndrome is really closely associated with depression and trauma, and so are chronic pain conditions like fibromyalgia or migraines. They really frequently overlap with mood and anxiety disorders. Okay, and number 6 are neurological conditions. These include like head injuries, like concussions. These can lead to mood and personality changes. Neurodegenerative conditions, diseases like early Parkinson's or Alzheimer's symptoms sometimes first show up as mood symptoms. So on a practical level, if it's possible that a medical issue is fueling your depression or anxiety, what should you do? I'll tell you what not to do. Don't just take a gazillion supplements, and don't take your symptoms down an online rabbit hole. Medical professionals should be your first step in determining whether a physical problem is at the root of your depression or anxiety. They can screen for most of the things I've talked about in this video, and then they can work with you to customize a plan, which may or may not include supplements or changing medication or other medical treatment options. I would just encourage you to tell them about your issues with mood and ask them to run some tests. You could screenshot this page if you want to know some of the tests to look for. You can also just talk with your doctor about options to improve your overall health, because anything you can do to improve your physical health can help improve your mental health and vice versa. Okay, I hope I saved some of you from years of therapy when what you really needed was a CPAP. Thank you for watching and take care.